Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Oral cavity cancer, and we are focusing on the TNM staging. So this is as per the AGCC 8th edition. So to begin with, we have the primary tumor. So the primary tumor, we are representing it as T. So TX is where it is starting. So TX means it cannot be assessed. Then we have the TIS. IS means it is a carcinoma, and I for in and S for the C2. So it is carcinoma in C2. Now, when you look at T1, T1 means the tumor is of less than 2 centimeters. So it is less than 2 centimeters. And what is DOI? DOI stands for the depth of invasion, and this is less than or equal to 5 mm. And the DOI is the depth of invasion and not tumor thickness. So it is just the depth of, this is to be noted, it is the depth of invasion and not the tumor thickness. Next is, we move on to something known as the T2. So the T2 is where the tumor is less than or equal to 2 centimeters. So this condition is similar to that of T1. So it's less than 2 centimeters. And the DOI in T1 was less than 5 mm, less than or equal to 5 mm. Here it is going to be, the DOI is greater than 5 mm and also less than or equal to 10 mm. Or there is another condition, or the tumor, it can be greater than 2 centimeters but less than 4 centimeters. So it is greater than 2 centimeters or but less than or equal to 4 centimeters and less than or equal to 10 mm of the DOI, that is the depth of invasion. Next we focus on T3. So what is T3? T3 means the tumor of, so this is a tumor and this will be greater than 4. So tumor greater than 4 centimeters or any tumor greater than 10 centimeters or any tumor which is greater than 10 mm of depth of invasion. So if the depth of invasion is greater than 10, it automatically falls under the T3. Now let's look at what is special about T4. So T4 means it is moderately advanced or a very advanced local disease. So it is moderately advanced, or you can call it very advanced. So moderately advanced or very advanced what? Local disease. So moderately advanced or very advanced local disease. Now let's look at A. So by A we mean the T4A. So T4A, there is a moderately advanced local disease. It is a moderately advanced local disease. That is, the tumor is greater than 4 centimeters. So tumor remains greater than 4 centimeters and it has a DOI. DOI stands for the depth of invasion greater than the 10 mm. Or the tumor invades adjacent structures only. So the tumor, it invades the adjacent structures. The tumor invades adjacent structures only, that is through a cortical bone of the mandible. So it can be the cortical bone of the mandible. So it is through the cortical bone of the mandible, or you can tell the maxilla, or it involves the maxillary sinus or the skin of the face. So it involves a maxillary sinus. So maxillary sinus or the skin of the face Next, we move on to, so other thing to note is that the superficial erosion of the teeth or the bone socket is by the gingival. So the superficial erosion, this is of the bone. So superficial erosion of the bone or the tooth socket, the superficial erosion of the bone of the tooth socket alone by the gingival primary. So this is by the gingival primary and is not sufficient to classify the tumor as T4. So this information is not satisfied to do it into T4. Next is we move on to the T4B. So T4B means it is a very advanced local disease. So it is very advanced. So by very advanced, the tumor invades the masticator space. So it invades the masticator space and also the pterygoid plates. Masticator plates, pterygoid plates. Also the skull. Also the skull base, or the end case is the ICA. For end cases, the ICA, that is the internal carotid artery. Now let's focus on the regional lymph node. So under the regional lymph node there is NX. So NX, it stands for the it cannot be assessed. Next we have the N0. So N0 means there is no regional lymph node metastasis. There is no regional lymph node metastasis. And then we have N1. N1 means there is a single ipsilateral. It is single, it is ipsilateral, and it is less than equal to 3 centimeters. Also there is a extranodal extension. We are writing it as ENE, that is external extension. This is negative. Now what is N2? N2 means there is a single ipsilateral lymph node. So there is a single ipsilateral. There is a single ipsilateral lymph node, and this is greater than 3 times. This is greater than 3 centimeters, but it is not greater than 6 centimeters. It is larger than 3 centimeters, but it is not greater than 6 centimeters. And here the ENE, that is the extranodal extension. So the ENE is negative, or there is a multiple ipsilateral, or there is multiple ipsilateral lymph node, and this being less than 6 centimeters, and the ENE is nothing but it is negative. Then comes the bilateral. There is a bilateral or the contralateral lymph nodes. So this bilateral as well as the contralateral lymph nodes. Next is it is less than 6 centimeters, and the ENE, if you see, it is negative. Then we move on to the N2A. So in terms of N2A, it is a single ipsilateral lymph node. It is a single ipsilateral lymph node. So it is a single ipsilateral lymph node. It is greater than 3 centimeters, but it is not greater than 6 centimeters. It is not greater than 6 centimeters. And it is ENE negative. ENE, as we know, it is an extranodal extension. Next, we move on to the N2B. So in terms of N2B, it is a multiple ipsilateral lymph node. So it is a multiple ipsilateral lymph node. So N2B stands for the multiple ipsilateral lymph node, and this is less than 6 centimeters, and the ENE here, it is negative. Next we move on to the N2C. So in terms of N2C, it is nothing but it is bilateral. It is bilateral, or you can call it the contralateral lymph nodes. This is less than 6 centimeters. It is less than 6 centimeters, and it is ENE negative. Then comes the presence of N3. N3 is nothing but the metastasis. So metastasis is nothing but a lymph node greater than 6 centimeters. So lymph node greater than 6 centimeters and ENE negative, or the metastasis in any lymph node, or the metastasis in any lymph node in any lymph node and clinically over the ENE positive. So this is N3, that is the metastasis in a lymph node larger than 6 centimeters, and ENE negative or metastasis in a lymph node and clinically over the ENE positive. So when you look at 3A, 3A means there is a metastasis of the lymph node greater than 6 centimeters and the ENE negative. So 3B, it means that the metastasis of any lymph node. So this is in terms of any lymph node and it is clinically overt ENE positive. It is ENE positive. To learn and grow daily like this, please do subscribe.